All right, thank you.
Good morning, everyone.
Good morning.
All right, good morning, everybody. Thanks for coming. Well, good afternoon for some of you. Uh, Welcome to Clean Air and Traveling, presented by Public Health Action Network and the Air Support Project. Today's Tuesday, May 5th at noon Eastern. I'm Teresa O'Connor. I'm the Communications Manager for PHAN. Joining me as our co-host today are Sarah Massey from Air Support Project, Melissa Smallwood from Air Support Project, and Amanda Finley, who will be speaking for PHAN. Um, Public Health Action Network and Air Support Project are both 501c3 nonprofits. We're both deeply engaged in the work of making sure clean air is a right for everybody. Public Health Action Network is doing it with advocacy, and we're creating software tools for the clean air aware community. Air Support Project is building a state-of-the-art, high-quality, low-cost air purifier that will be hopefully being brought to market shortly. Just some housekeeping notes. This space is being recorded. We'll provide the recording on YouTube. I will send out the link to everybody who is registered, and we'll post it on social media. To join the conversation, you can put a question in the chat. And I think that does it. All right. So let me introduce our guests. We have Julie Lam from Mass Together America. Julie is well known in the COVID safe, clean air aware community. Mass Together America is just a really terrific organization that's really taken social media by the horns and just promotes the heck out of masking with dozens and dozens of high quality photos every week of beautiful people wearing beautiful masks. Julie, thank you so much for your work. We really appreciate all the great social media work you guys do. And we also have Keith Muise from uh, he lives in Newfoundland, Canada, and he's done some extensive traveling across the country with being COVID safe. So welcome, Julie, and welcome, Keith.
Ew.
Okay, should we get
Thank you
started?
for having me.
Oh,
Sure,
thanks so much for being here, Julie. I appreciate it.
absolutely.
You want me to
Yeah.
start or do you want someone else?
Amanda, go ahead.
Okay, so we were going to have a third guest, my best friend Danielle, but they have long COVID and things happen. But half the time they have been traveling while COVID conscious. I've been in the front seat with them. So it's because of me that they're traveling. I'm so sorry, Dan. But let's start with question number one. How did you get into masking? Was it because of COVID or the general public health info and messaging? Was it something else? Julie, do you want to go first?
Julie, you're muted.
Can you unmute? She might be. Yeah, I have to unmute her. I got her.
Sorry, how do I get into masking is a really good question. It's really, I started masking during the pandemic. Before then, I don't wear masks. I didn't know that I need to wear a mask anytime, but it was really the pandemic when I learned that wearing a mask can protect me from getting sick and then catching it and now like have long COVID and obviously, learning that how COVID can damage your immune system and make you susceptible to even more infection from any pathogen really. And so there's no reason not to wear a mask and also pay attention to the indoor air quality as well. In the beginning of the pandemic, it really is just, friends that I have in Asia that have experienced SARS-1, they told me that wearing a mask is crucial, especially how they impact the healthcare, frontline workers. That a lot of people in Hong Kong, who are healthcare workers, they die in SARS-1. So they warned me, and at that time there was actually a severe shortage of masks in the United States, and even emergency department of a hospital would have no mask mandate, and healthcare workers have a hard time getting PPE. So we were all restricted from, getting N95, and I have to buy my mask from, not very good quality mask from price gougers in the States. And my friend actually in Hong Kong sent me a box of high quality level 3 surgical masks. And so I lay it out, and I was wearing like cloth masks over the surgical mask, and like really properly sealing them, along the side. And even though I started, the campaign, taking pictures of people everywhere, I double mask at that time, in 2020 onwards. I interview a lot of people everywhere, in airports, and I never got sick when I was wearing masks. I mean, I was exposed because I was visiting family. After I was fully vaccinated, I went to see my family, and that's how I was exposed. I was very trusting on the vaccines, and I let my guard down.
I'm so sorry, Julie, and we know how that went. Here we are. Keith, what got you into masking? What's your DM here?
My first foyer into masking was for wildfire smoke, actually. So I used to live in northern Alberta. Every year we would get forest fires either in the province or in British Columbia, and the jet stream would just bring all the smoke from BC. Every year we would have clouds of smoke. So after a while, I was like, I can't keep breathing this. So I got these. They were cloth masks, but they had a N95 insert. Right. I think they were like from China or somewhere. I don't know where I got them, but I was like, hey, these must be great. They got N95 filters, and I didn't know any better. So I was like, yeah, these are the tops. Then we actually had a forest fire in our city, and it left a lot of burnt buildings and things like that. So on reentry, I got one of the plastic sort of double, filters on the side, like top notch, $100 mask to reenter the city. And I wore that for like 2 days, and I barely drank water because I was like, oh, I can't let all the different chemicals get on me and whatever. And I was super cautious. And then I kind of abandoned masking for a couple more years, and then COVID happened. But I still had some of my little insert N95s, and I use that term loosely because clearly it was junk. But still, I mean, I had on a cloth mask, so I felt like, yeah, I'm doing something here, because at the time it was the whole all you got to do is wash your hands thing was still pretty popular, and I was like, they would tell us if it was in the air, right, gang? Yeah, so I kind of felt safe at that time. Used the surgical masks, the baggy blues, but I didn't really get into N95s until years later. Luckily, I didn't catch COVID in that transitional time. Just with my little cheap cloth masks and painter's masks or whatever I could get, because like Julie was saying, at the time when the pandemic first started, it was hard to find anything that was better than a cloth mask or a baggy blue or whatever else, right?
Well, they told us that we had to save those for the healthcare workers because there is a shortage.
Yep. Yeah. And there was, but we shouldn't have been discouraged from wearing them just because there's a shortage, right? But it's a tough situation, but that's where we were. I felt safe anyway. I was like, I got my cloth mask, or if I just do a scarf, I'm doing more than most people. But yeah, I mean, you live and you learn. But it's been quite a transition from then to now. It's like, if I don't wear a mask, if the neighbors are out in the yard, I'm kind of like, "Ugh." Like I'm gonna catch something. Yeah, so that's
Well, speaking of learning, where did you learn? Where did you get your information about being COVID safe and traveling? For you, Keith.
me. Okay.
You're it.
Yeah, just you know what? The bashing that social media takes is sometimes justified, but without social media, I would probably be, still like, wearing whatever. It was a trial by fire kind of thing. And once I started talking to people and, paying attention to posts and, the things that I was wearing, people were like, do not wear this. It's not going to protect you. I was like, what if they're right? And, the government's wrong. But even still, it still took me quite a while to sort of feel the danger of COVID, right? So I didn't immediately, I wasn't like, oh, everyone has COVID, kind of like I feel now, I'm kind of like, uh, I just assume, I use a precautionary principle and assume that everybody could have COVID or the flu or whatever else. But back then I really wasn't because I was still on that, sort of train of thought of there would be symptoms, right? If somebody has COVID, they're gonna know it, sort of thing, right? So social media really saved me because where else would I connect with a whole bunch of scientists and fellow advocates and things like that? My friends aren't going to be doing it, and they're not scientists. So I was like, if I was going to rely on my circle of friends, they'd be like, no, it just wouldn't have happened.
Yeah. You'd be in my long COVID group.
Yeah, exactly.
Very much.
I would have been like, COVID is made up. It's the government. Yeah. So I'd
Why are
be.
my teeth falling out? Yeah. So, Julie, what about you? Where did you get your information about being COVID safe and traveling?
Well, being COVID safe, it does not really restrict it to just traveling to me. I live in New York City, so I live in a building where we share air with hundreds of people living in the same apartment building. So New York City is people everywhere. So whether I travel or not, I have to practice COVID safe everywhere I go. And I think I got my masking degree from Aaron Collins, the mask nerd. I mean, he had this extensive video series that taught everyone about all the different masks, introducing us to, properly fit testing your mask, making sure that it's properly sealed, and also explaining that, breathability, you need to be able to breathe through the mask and feel comfortable about wearing your mask. So Aaron really educated us a lot about proper masking is really important, and also shopping for the right mask. I always tell people, they ask me, oh, what mask would you recommend? And I would say, I'm sorry, it's like buying shoes. You have to wear it, fit it, and see if it works for you. What works for me doesn't mean that it will work for you. So I just don't do any specific pose that will actually endorse a product, because what if it doesn't work for someone, that it leak air everywhere, and then that person caught COVID, and then there's liability issue for me. But I do think that inviting experts like Aaron Collins to talk about, he's a aerosol scientist, and he really know a lot about ventilation and also wearing masks. Happy to introduce you to him. He has come on to Master Care America's forum 3 times, and I never get tired of listening to him. He's just so good with talking about masking. And the other person that I want to call out is Nicholas Smith. He was one of our founding member, and also advisor to us. And he is a mining PPE engineer, and now working for Elastomeric Respirator Company. But he joined us, and we worked together and created this chart. I'll put it in the chat to help people see the work we have done in the last 6 years, really to learn and share information. And it's a really friendly chart because it's fun to look at. You can show it to your child, and it will be like pointing to all these smiley face, wearing different masks, and why, not wearing a mask looks really sad, and the other one are more protected. And there are lots of options. If people have no access to affordable, N95, good quality N95 can be really expensive for people. And so surgical mask, if your only option is wearing surgical mask, if you buy a mask brace that tightly seal around the mask, you do get like good level of protection.
So what about you, Keith? Actually, Julie, I'm going to stick with you. Other than these two, sorry, I'm pulling back my notes. I closed my phone and I forgot. Oh, wait, I needed that. No, so what other sources do you find to be most educational besides this platform that you've built, Mask Up America, or Mask Together America?
Well, I follow like one of our advisor, Dr. Michael Erga.
Of course.
He is a oncology psychologist, but also very into data science, and he has been reporting on COVID waves and whether the ebb and flow of everything, and he's on it. And so I follow him, and he will alert us. We're in the same group, and he's my advisor. So I'm kind of like very lucky that way, that I'm very informed. And then the other place that I go is the wastewater scan dashboard, which you can also get an idea of what is circulating besides COVID, like flu, all different types of flu and RSV, all other like pathogens that are airborne. You can really get a good glance of like everything all at once from the wastewater scan dashboard. So those are the two sources that I find reliable and comforting to have at this point. I don't want to talk about government. You can't really tell what source you can recommend, and they evolve, they change all the time. And so even if you see it looks like really green and like nothing's going on, but honestly, I will wear my mask because you just never know. You just don't know if someone is having something, and it could be asymptomatic. Like my husband, for example, he work in person, right? When he's sick, he got COVID, he doesn't show any symptoms. He's asymptomatic, but he routinely tests because I'm immune deficient. So he tests, and then he was like, "Oh my God!" And then we were like, "Okay, you go away." That's separate from me. But there are a lot of people. Majority of the people, over 50% of people spread viruses asymptomatically. Like they don't show symptoms, and the acute phase look mild to them, but that doesn't mean that they don't shed viruses. And also, as we learn more about the immune dysfunction caused by COVID, people actually can have viral reservoir in their body, and they can reactivate. And like other viruses too, EBV can reactivate. COVID can reactivate EBV. And I mean, I'm not going to want to take the risk. And having long COVID is enough. And so, and also like I don't think it's only airborne viruses that we have to be careful and cautious about.
Right.
I mean, even though the Hanta virus is zoonotic, like from rodent, but they don't talk about this, right? But it's also, you can inhale.
Yes.
The viruses spread from the feces or urine from these rodents.
Yeah, that's actually very common knowledge where I'm from, out in Western Kansas. You don't go sweep in the garage without a mask.
Exactly. I'm going to wear my mask, but I'm actually definitely not going to go on a cruise for sure.
Yeah.
I mean, haven't we learned enough
Right.
that why are people taking a cruise trip? I don't know. It's just the risk is too high for me.
Yeah. Well, what about you, Keith? How would you answer that question? What other sources do you get?
Well, I guess it evolved as time went on. So early on, obviously, it was the government that I turned to, right? I thought, hey, these are the folks that know. These are the people, the people they put on TV and became sort of rock stars at the start of the pandemic here in Canada were our chief medical officers of health and, health ministers, even premiers. Everybody was loving the spotlight. And so once you get people on the news every day, you start thinking, okay, they must know what they're talking about, or the media is going to, call them out on it. So if somebody says something like children can't catch COVID or COVID's not airborne or all you got to do is wash your hands, you would figure somebody in the media or in other government agencies or in scientific realm would check them on that, right? So once I heard, kids couldn't catch COVID, I didn't, they didn't really give a reason, or if they did, it wouldn't hurt them. I was like, okay, I'm gonna have to start looking elsewhere for information because I'm kind of getting the feel that I'm not being, told the truth, right? So I went from, oh, the government's on TV, let's turn it on and let's see what they're saying today, and we're gonna do whatever it takes to win this fight, to I think you guys are full of it, and I need to hear from some regular folks who actually don't have private jets and private doctors and everything else. Right. So I really went from trusting the government, not too much, but, I figured, hey, they're on the news. They're not going to give us information that's false because back then we still had these crazy things called accountability and fact checking and media. And so we had all those crazy, conceptual organizations and people, and they still did, what do you call it, their jobs. And, people would get called out on lies. Right. So if somebody said, AIDS cannot be transmitted through blood, someone would be like, what? Lawsuits would be flying off the charts. But same with COVID, it was like you could make claims, no one fact check it. There's nobody holding anybody accountable. So once I started hearing things like kids can't get it, schools are not a spreader of COVID was the other big one for me. Being a teacher by trade, I was like, you're telling me that this is the only virus on the planet that doesn't spread in schools? Because if it's in a school, I would catch it. Right. So, I kind of transitioned from the government knows everything and they're going to share and they're going to help us to, I need to find some real folks who know what they're talking about, don't sound scripted and have nothing to gain. Right. So when you see organizations like Julie's and, advocates like Horger and the rest of them, it's like, those are the folks I need to be following. Right. Because they're not counting on votes. They're not counting on corporate donations or whatever else was driving the nonsense, right? Like kids can't catch it. They're too short, is what I heard from one person in a school district. I was like, they're too short. So this is like an altitude determined virus that cannot sink below a certain height. I was like,
Oh
well,
my
that's
God,
easy. We'll just crawl around, right?
That's hilarious.
Yeah. I'm like, seriously. So it was kind of around then that I checked out of government town and started going to, the public, the people who actually have nothing to gain, right? So that was my journey for info.
Well, I'm gonna switch over here to Daniell Kinder we've been best friends for 25 years. Dan, what sources have you found to be the most educational, and do you have a particular mask or other tools that you like to use when you're traveling?
I'm sorry, could you
Oh, you're good, Dan.
repeat? I didn't quite catch the last half of the question.
So, what sources have you found to be the most educational, and where did you get your information initially about being COVID safe and about traveling?
Oh,
It's been a
what
journey.
sources do I use now? There are multiple COVID conscious groups on that I go to for information. One of them, Dr. Sunderland, every 2 weeks or every 4 weeks of COVID around the nation, and she opens up for questions about if anyone has any questions about like vaccine availability or like suggestions for travel and things like that.
Yeah, I think you're cutting up a little bit. So why don't you try turning your camera off so that way we get the audio better? Let's try that. There, yay. It's not that I don't love seeing your beautiful face.
No, it's fine. It's fine.
Oh, that sounds better.
Yeah, that's much better.
Okay, awesome. Awesome. I was saying that there are a few COVID cautious groups on Discord that I'm a member of. One of them, Dr. Sunderling in Wisconsin, does like an every, I don't remember if it's every 2 weeks or every 4 weeks, but she does like a state of COVID address, I guess, kind of. It's like a live Q&A type thing, and people can come in and like ask questions about, hey, I'm planning to travel on X date, and do you have any insight on vaccine availability so that I can plan getting my booster vaccine before this big international travel thing or this big like family wedding event that I have going on in like 6 months or whatever.
Yeah.
As far as up-to-date local information about COVID, there is a wastewater database for like Missouri and the St. Louis area. I have a really hard time navigating that though.
Yeah, I've had the
Um,
same issue.
yeah, it's not intuitive to navigate, and I have had some issues interpreting the data that's on there. So, like, my family just masks all of the time when we leave our house. That's like obviously not like the most comfortable way to exist, but definitely the safest, seeing as like 2/3 of us already deal with long COVID, and uh, getting another round and going through all of that again just seems like the worst thing that we could do. Um, but yeah, I can't remember the names of the Discords. If folks want Discord names, I can relay that information after the meeting or whatever.
That would
You
be
But
text it, yeah, you can text it to me and I'll get it out.
that would be great.
awesome.
And I can include
Um,
that in the email to our registrants.
Sweet. Um, yeah, it's mostly been on Discord, and there's also a Discord specifically for research-based stuff. Um, and getting information from there has been super helpful because they express purpose for that Discord is like keeping a record of what's happening in COVID research, and like it's actual scientists who are in charge of that. Um, so we can ask them to explain things in layperson's terms instead, so that we can like get a better understanding of what's actually going on with the studies, and that has been super helpful as well.
And this is something I'm going to stick with you for a second here, Dan. Do you have any particular masks or tools that you like to use?
Oh yes.
Yes.
My family loves the V-Flex masks from 3M. We liked the Gerson duckbills too, but the V-Flexes seal better for us than the Gersons did, and they also move better with our facial movements. I haven't done formal fit testing on them yet, but like qualitatively, my observations from going through so many different types of masks over the years, these ones are so far the best fit that we've had. We do have some elastomerics from 3M that we use when we're planning to do like high risk things. For example, the most recent was my wife and my kid went to a concert in Del Mar Hall for one of his favorite bands, and they both wore their elastomerics for that. Um, I'm not sure yet if we're going to just wear our regular V-Flexes or if we're going to swap over to elastomerics for the concert that's coming up. But there is a masks required concert happening in St. Louis on May 16th, and we're super excited for that. It's with a band called Purity Ring.
Cool.
And like, yeah, it's going to be the first all family concert thing, and we're all super excited for it.
That's awesome. And someone had a question earlier up in the chat about the difference between, you know, what's the difference between like an N95 and a flow mask, and why would a flow mask be, what's the advantage of that? I have like zero chin, and when I put any type of N95 or duckbill or whatever on, there's no seal. Cannot get a seal. So the flow mask has a nice stiff body, but it has a silicone ring around it, and I get a good seal, and that's all I've worn for like the last 3 or 4 years. So, but let's see, where were we? Keith, what about you? Mask tools.
What was that?
What about you? What masks and tools do you like?
Our family uses Vitacore N99s, ear loop ones. I have to tie a knot in the earpiece. I have to stick it on my nose because my nose is super crooked, but they're super breathable and stuff like that. And for some reason, I can't wear the head strap ones of the same kind very easily because some weird chin issues. I don't know what goes on, but every time I talk, it like rides up and I'm like, ah. So I got to basically destroy my ears to wear mine. So it's super awesome and comfortable and breathable. I'm not really selling the mask very well right now, but like Julie said, just because it works for me doesn't mean it works for everybody, right? So it's find the ones that fit for you, find the ones that are affordable, because that is a big hurdle for a lot of people, right? It's easy for us to say, hey, go get an N95 or N99 or N1 million, whatever you want. But not everybody can afford them. And luckily, we do have organizations out there that help people get masks if they mask blocks, and then individuals who do that stuff. And even some mask companies give them away. So yeah.
And Keith, I'm curious, how have you traveled in Canada, like using COVID precautions?
So most recently, so my first trip in my evolution of travel and masking and precautions and whatever was in 2020 when I came across the entire country. So at that time, I really wasn't taking the air into account when I was thinking of safety and precaution, right? So I was thinking of surfaces, I was thinking of touching people, the 6-foot rule, all the rest of that. So I didn't really see a hotel room, motel room, wherever I was staying on my long journey, because it takes like a week to get across our country. I didn't see the room itself as a threat, right? But, really I should have been thinking about, hey, whoever was in cleaning it could have had an infection and left behind, a gift for me in the air. But at that time, I really wasn't taking air into account. So it was all surfaces. So I tell people, my son, my family, we would play the world is lava, not just the floor is lava. You don't want to touch anything unless you're going to go in and hose down the whole room and Lysol and peroxide and whatever else. Just don't touch a whole lot of stuff. So what I would do is take a king size sheet, because I bought 6 of them for my trip, and just put it over the whole hotel bed. Sleep on my own pillow with my own blankie, just not touch anything. Like, so if I was going to the bathroom in the middle of the night, it was kind of like Indiana Jones, right? I was like tiptoeing or walking on my heels, and then I'd get in the bed, literally spray my feet or wipe them with sanitizer or whatever. And again, I'm still not taking into account the air, right? So that was my first trip. But, in my most recent trips, I added the air to the list of things to do. Right. So at that time I would mask, but I would take the mask off in the hotel room, and, and I felt safe because, that was the information I had at the time. But now I've added the air purification and, airing out the Airbnb or room or whatever to the long list of things that you need to do when you're traveling. Right. Because it's like anything. And I mean, I've talked to people who were chronically ill before COVID. And basically for them, I mean, they would have to take this sort of precaution, extra precaution, extra steps, extra effort to, to just do the things that everybody else does with ease. But now I'm adding, uh, so we went on one trip to St. John's, Newfoundland, and it's like 9 hours away. We get there. After the long drive, we have to air out the place, put in 4 air purifiers, run them on high, go in, scrub everything down, right? And it's just a lot of work on top of, the already tiring job of driving for 9, 10 hours, right? So, but now that I take air into account and it's part of the checklist, so now I feel like an astronaut or something showing up on a foreign planet, right? And it's like an alien planet. It's like, is the air breathable? We don't know. We got to run some tests. So I go around and, do my whole thing of cleaning and replacing the bed sheets and all of it. And then I can relax, after 6 to 7 hours because I'm, slightly overboard most of the time. So it just traveling now, there's a lot of extra steps, right? Steps that I took, for granted. But like I said, now talking to people who are chronically ill, and even some of the kids that I used to work with back when I was a teacher, I didn't really understand the amount of extra steps that they had to do just to go somewhere, right? It's not as easy as, hey, jump in the car and go, right? It's jump in the car and make sure you have, Lysol and wipes and masks and air purifiers and, change of clothes and whatever else, right? Because I've adapted I'm going to mitigate and I'm going to neutralize as much of the risk as I can, and then I can relax because I know, what awaits me if I let my guard down, right? I've heard the stories. I have plenty of friends who have long COVID. I don't need to learn the hard way. They've already taught me, the hard way. They've told me, and even then, I still can't fully understand it. I still can't fully, put myself in their shoes, and I don't want to, right? Because they've warned me enough. I'm not going to be like all the effort you've put into warning me and telling me how terrible this is. And I'm just going to go, whatever, I'm going on a trip. I'm going to go on a cruise. Like Julie said, what are you thinking? Right. I mean, come on. So yeah, that's the evolution of my travel. It went from the air, I don't care, to I'm an astronaut on an alien planet. So
I'm sorry, Dan, did you had something to add to that?
Follow-up question, but kind of explained
I'm sorry,
it.
go ahead. Go ahead.
Don't worry about it.
Was this directed toward me?
Yeah. What
Okay.
other things have you been doing? What other mitigations have you taken?
For the hotel rooms, running air purifiers for sure. I have found that ready masks with the adhesive can be attached to vents in some hotel rooms to help with mitigation that way. Also looking for a hotel room or motel room with a door that opens to the outside. Or maybe not necessarily a door, but the air conditioning unit is attached to the outside individually for each room, and that helps limit any spread between rooms because then the air for each room is individual as well. I do know some people who bring along like super wide masking tape or gaffer's tape and tape up the doors once they're inside of their room as well.
And what about you, Julie? Tell us, what does it look like for you? What other sources or what other things do you use, like tools, masks? What works for you?
Well, I find that first of all, Danielle, I'm with you. I also like the 3M V-Flex. I find that it gives me a really good seal, and it's also very practical as a photographer. It's very comfortable and breathable when I have to work on site to cover a photo shoot, which is not usually interviewing and talking to 50 people at a time. So I really have to have like maximum protection. So I always wear N95, a really fitting N95, and then After the job is done, I throw this away. But on plane, I would not wear a V flag. I would wear an elastomeric respirator. And I also want to show everyone that what you were talking about, the ready mask, the stick-on ready mask is like this, the yellow filter mask that you can see here. It's N95 quality if you properly put it around your face and seal it properly. And my to-go mask is the flow mask, which gives you a very good seal for some people, especially for my face, really work. So Amanda, I'm with you too on the flow mask. I also bring this with me, the CO2 monitor checker, just to see, if the ventilation is good, and to make sure, if the ventilation is really bad, just leave that room. And if it's like okay, and if you really need to drink water or like I don't know, like hold your breath when you eat something and then put your mask back on quickly, then if the CO2 level is really good, like this is a good number, like 600, below 600, that's really good ventilation. Then you're probably safer than if it's like 3,000 ppm. And that means like the ventilation is really not working. So everyone needs to learn to measure their risk. And I also want to show you that elastomeric mask like this with these giant filter. They make it really breathable for you to take a long flight, and you can fall asleep wearing this. And but it's not good if I have to work as a photographer because I need to have my camera on my face. So it kind of like stick out, and the protrusion of the structure make me unable to work. And also definitely bring test with you. Always test and ask other people to test. And also ask people to be honest. If they have symptoms, please don't show up. Nobody want to take the risk. And when you're traveling, you don't have access to your doctors. So it's a higher risk if you get sick. So it's really important that when you travel, really talk to whoever you're interacting with to get everyone tested. And also make sure people don't have symptoms, that they have to understand where you're coming from, that you don't want to take the risk, and just communicate that with people.
So what would the contingency be if someone tests positive? Just cancel everything? Like I can see that being an issue with if you're traveling somewhere for a specific event and then it gets canceled, and so either what was all the travel for and you have to go back or you have to stay longer. So how do you handle stuff like that?
So if I tested positive, I would not show up in any of those events or gathering. I would just say I cannot come.
What if you ask someone else to test and they tested positive?
Then cancel. Absolutely cancel, because our health is our priority. And why take the risk? Because it changed your life when you develop long COVID, and your life, and it's not just your health but also the quality of life. And what followed that, it impacts everyone surrounding you. And long COVID is really a life-changing experience. It makes you forever feeling isolated because you also have to deal with, all these medical appointments. evaluation and really get into an area that's really depressing. So I highly recommend people to take this really seriously. If you have symptoms and if you tested positive, you really have to like look out for other people as well. We are a community, right? Wearing a mask or like canceling, it's really about community care and love. We need to love our neighbors. We need to love other people too, you know. And I think thinking it through, putting other people's life first, it's how we can build a stronger community. It's how we can actually eventually end this pandemic. Because right now people are not really thinking about other people. A lot of time their action is driven by, you know, putting themselves first. And I think source control is really like the top of the pyramid in terms of like prevention. For mitigation, we must think about, you know, source control, which is like avoiding transmission from the source. That means like people have to have paid sick leave, you know, we need like to have allow people to be absent. And I think that's one of the biggest problem for school transmission is that now even in college, professors are asking people, even if you have asymptomatic and even if you're testing positive, you still have to show up in the class as long as you don't have a fever. That's wrong because everybody's gonna get it. And it's in the air, right? It's an airborne virus. So some people might not show the long-term effect right away, but that doesn't mean that down the line, years from now, you're going to be okay. Your organ is exposed to these viruses, it damages your organs, and it's going to be, you know, it's like aging you fast. And it's affecting young people, affecting children, and children, they're developing their body, developing immune system. They're very vulnerable. And we got to protect children. And we already see this rise in chronic illness in children. And children are not supposed to have chronic illness.
Yeah.
And that is so unacceptable. And so we need to protect them, right? So I think we need to look at like the layer of protection, like prevention in the layer approach is the best. And we do whatever we can. You know, sometimes there might be, you know, a lot of resistance on certain, you know, tools. And so at least greatly improve the indoor air quality. And we need to set higher standard. So like the ASTRAE 241, which encourage you to have not just good ventilation, like HEPA filter, but also use air purification to clean the air. And that should be implemented in all the schools. And we should like really think about children's future and moving forward.
Absolutely. So hey, Julie, we've got some questions in the chat for you. One of them is about your chart on your website.
Yeah.
Why is valved respirator in the middle? If it's a PN 95 or 100, is it as protective as an unvalved one?
So the seal matters for N95. A lot of time N95 not sealing properly. So sealing matters. Unvalved N95 it's actually, you know, it's still an N95. And the valve you can tape from the inside, and it's really, really protective. And even if you read the NIOSH standard, they explain it really clearly. If you go to like 3M's N95 with valves, they explain how it's actually, you know, very protective against aerosol transmission. Except, you know, that you are protecting yourself for sure, because the exhalation valve is like you don't protect other people if you are infected, but you don't it's inhalation will be protected because it's the valve doesn't get the air through into you. So if someone can't breathe, if someone has asthma issue and they can't wear a mask, I will highly recommend that they wear N95 with valve because they need to wear a mask to protect themselves during traveling. So that is the key thing for people who has asthma, who is already high risk. And there are other people who have lung disease that cannot breathe. And we have to we need all these options because we have individuals that have different medical conditions that make them not able to use certain tools, right? Some people can't get vaccinated, for example, and some people can't wear certain masks. Babies can't wear masks, So valves mask is an option for certain people. And if you don't have any option, like if you don't have any mask, if someone say, here's a valve mask, would you want it? Would you wear it? Yes, absolutely wear that. And you can always easily tape the valve from the inside and then you protect other people as well. But the material is still N95 filtration.
Right,
I have a long discussion about this with Nicholas Smith. Nick really explained that to me. He pounded on my head, we had a lot of arguments about that before. And I was like, well, are you sure? And he showed me a lot of literature to read before we make this mask chart. He said that it's all tested and I have to trust him on that. And he's an expert. So, after reading all the literature, from NIOSH, and I was convinced that he's right.
Great. And there was a follow-up question, and you may have answered this sort of already. How is a flow mask more protective than a properly fitted N95? It sounds like the seal is just better, right?
It's the seal, but it's also comfort and breathability. And I find that elastomeric mask, with the design of it, fitting, if it's test fitted, it gives you this comfort and breathability that it's no comparison than an N95. Also, N95 has a time restriction as well. Same for elastomeric mask, but the filter lasts much longer. I think N95 you do have to switch it, and you do have to replace it. And so if you're traveling, so you have to count the time, right? When you go to the airport, you take the taxi or take a car ride, you have to count all the hours that you spend wearing the mask. And then in between, you need to switch to a new mask as well. And sometimes the strap can hurt a lot on your face. We need to be realistic too. No one will find it really comfortable to wear a mask for a long time because it really can cut into your ears. So the comfort part is important.
Absolutely. That makes sense.
And then also you want to dress up and you want to blend into an environment. So some people will say, I want to wear N95, right? So I recommend people to use a strap, like an extra strap. So when you wear N95, right here, can you see? And then you add a strap to the top of your hair, so that you can make it like an N95 seal with that. I don't know if you can see it. Can you see it? The extra
strap? Yeah.
On the back that you can add onto a KN95 to increase the fitting.
That's cool.
Anyway, there are a lot of ways to make your mask really seal around your face.
Excellent. I have a question for all of you. Curious if anyone in the US has successfully flown in an Omni mask, clear elastomeric, without being made to remove it at TSA or on the plane.
Not applicable to me. I'm a Canadian.
So let me find it. So our
Julie.
professor, Maria Gillespie, who's a professor, she is part of our group. She's the founder of Mask Together Colorado. she is someone that has worn the only mask and had flown, and they didn't even ask her to take off the mask at TSA because they could see her with a clear window. So I can't speak for her, but she has posted about it, that her experience, it said that they didn't ask her to take it off.
Let's see, we kind of got off we were answering all these questions. Thank you for keep the questions coming.
A lot of questions coming.
Yeah.
Yes.
So how often do you travel? Dan, it's been a while since we've heard from you. And Keith, do you travel ever anymore?
Who are we talking to?
Let's go to you, Keith. How often do you travel?
Not a lot, not super frequently. Probably out of town for overnight stays, once, twice a year, to different towns, like 3-4 hours away, quite frequently. It's just those little adjustments, right? So if you're going somewhere, like we were talking about earlier, what's your plan? What's your protocol if you get sick or somebody shows symptoms or whatever? So for me and my family, we pull the plug. And, we reiterate it to my son before we go anywhere. If we show up and we're sick, we're bouncing, right? Or if we go to, an event or whatever, he knows, okay, if there's somebody there coughing and it's just allergies, like we hear all the time, we're like, okay, well, we have allergies as well, and it's to being sick. So we bounce. There's no ifs, ands, or buts. And we're really disciplined when it comes to that. It really stinks sometimes because then you have to miss things, right? But I mean, if it's an automatic decision, like you don't do the shuttle's not taking off if one thing is wrong, kind of thing, right? Yeah, so we pull the plug on trips, pretty at the drop of a hat, sort of thing. And we don't travel super frequently, but there's always that, like I said, there's those extra steps, right? You always have to take them. If you're going 2 hours away, you have to be cognizant of where you're going, how many masks you have, do you have sanitizer, all of those things that you didn't have to worry about before, right? You just have to do your little checklist and go.
What modes of travel do you use when you go?
Once in a while, plane, not myself. I haven't been in a plane since 2020. My wife has flown. My son has flown. Mostly it's just drive, right? So we live on an island. So anytime if we do want to leave, we have to take an 8 or 9 hour boat ride, which again is another environment. You're like, okay, I got to go in. I got to scrub the place down. Like I'm a forensics team, and then I have to turn on air purifiers. On a ferry, you can't open cabin windows. It's not an option. So for that kind of stuff, you leave the mask on the whole time, right? And you get a drink out on deck, away from people, away from all the allergies, and yeah. So,
what about you, Dan? How often do you travel? Why do you travel, Dan? What are you doing half the time, Dan? And what modes of travel do you use, Dan?
Oh, I don't know. We do a lot of stuff in town, but like with people we don't necessarily know. So I do a lot of mutual aid work, like a lot of mutual aid work. So when something's going on and like someone needs desperately to get from point A to point B for a multitude of whatever reasons, we'll mask. I'll mask in my vehicle.
Everybody masks.
I have masks all over in my vehicle. I do work for a mask block as well, so like I've got choices. But I don't always make everyone who's in the vehicle with me mask, because I have found that my N95, the solution that I have now, if I'm wearing a new one, seals great. Also, ventilation in my car I can handle with windows and whatnot. But yeah, that's how I handle that. But also, we recently went to the neighboring town for a big anime convention. And like our family masked up. My kid was all like in his cosplay stuff, masked up. Um, they went and they enjoyed the con, brought multiple masks with them so that they could change them out. Like if they got hot and sweaty or like something happened or somebody needed one. Someone actually walked up to my wife and said, "Hey, I see that you're wearing a mask. I'm not feeling so great. Do you have one I can have?" And then my wife was able to just like hand them several masks, which was spectacular. But the most recent travel we've done was to visit my family in Michigan in September. We try to do actual travel like in the spring and the fall when temperatures are not excruciatingly hot or cold. Um, the plan for going up to Michigan from St. Louis was that we would bring the tent with us to go camping if needed. We love camping, so that's not a hassle for my family to do. Um, Other people obviously have varying abilities or opinions about that, and um, other solutions would need to be found at that point. But we went up to Michigan. My sister's family tested with our Plus Life tests, no problem. Everybody tested clear, and I felt like that was enough that we could unmask with them and their family for the evening, have a dinner, hang out for the next day before we did the last leg of our trip up to my parents' house. I was originally told that my parents would both test. My dad decided at the last second that no, he was not going to. And no, he was also not going to go stay down the road with my brother while we stayed at the house with my mom. So we ended up camping in their front yard. They live next to a national forest and have the space to do that. That was part of our backup plan because I was not sure what the word is. I didn't exactly trust the statement that my dad would test when we got there. Um, so we had kind of planned for that. So what we did is we camped in their front yard. We would mask up before we would go into the house to use the restroom or um, talk to people, get coffee, and then we would come back outside to our camping chairs and whatnot to eat and drink our coffee and hang out amongst ourselves. We kind of kept distance between my family and my parents while we were there when we were outdoors. And that was basically how we handled that. Like, we did not have space in the car on that trip to bring our really nice air purifier. And I did not have the capacity to pack another couple of box fans and MERV 13 filters in the car at the time. So we didn't have any air filtration options that I could have employed at the time. Normally, when we do travel, we do bring those air purifiers with us, or I do like the modified CR box thing where I tape a MERV 13 filter to the back of a box fan, and it does not have to be like an actual CR box cube. ASHRAE, the foundation for air filtration and whatnot, has done testing and proven that just taping a single furnace filter to the back of a box fan does not in and of itself pose a fire hazard of any kind. So there have to be other extenuating circumstances happening for the fan to become a danger in any way related to that. So that's made us fairly comfortable taking our own filtration because we can't afford like the nice air filters and stuff. And like the MERV 13 filters are not HEPA filters. But if they run enough, the CR Foundation has posted and shared information showing that they're not filtering to HEPA standards, but they are filtering the air in a high enough quantity that it is comparable to HEPA filtration. So that's what we normally use.
Well, I have
Yeah,
to say, oh, I'm sorry, Dan, go ahead.
Go ahead. You're fine. Go ahead.
Oh no, I was going to say at this point, I should probably point out that half the time Danielle is doing a road trip, it's to get me in Kansas City, 4 hours away, and to bring my sorry self over to St. Louis, another 4 hours away. And we mask. We mask in the car. We have the windows vented. They pick me up in the middle of the summer, in the middle of the winter. But we find a way. We find a way. And sometimes when I get to St. Louis, rather than making Dan tote me all the way back over, I'll take the train. And I've done this many times now. When I'm on the train, I've got my flow mask. I just don't take it off. If there are restrooms on the train, I just don't take it off. Yeah, I hear you about restrooms and right. As long as you've got like that, and it might be that you might feel more comfortable in a different mask, like something something a little more heavy duty. And I'm sure Dan can probably give you some ideas for that. Now, eating on a train or a plane, a plane is a lot trickier, but at least on the train, I always take a small portable air filter with me, and I'll leave my mask on, take a bite, but I have that air filter with me too. I'll like hold my breath as I take a bite, and that's not ideal. But if it's a long train and I need to keep my blood sugars up, well, yeah. Anyhow, so Julie, let's go to you, Julie. You always like, how often do you travel, Julie, besides all the time? And what modes of travel do you use?
So I travel for work and also for personal reasons because my parents are very old, aging. I need to see them. And also my son, we're empty nester here. My son is studying in UK in grad school. So it's, I don't really travel a whole lot, but if I miss him just so much and he really can't come home, then we will have to like take a trip to see him. And for my work, which is like for Master Care America, I created this documentary project since 2020 to interview people and expand it to become a national campaign. That is it's like a challenging project that I have put on that I've undertaken. Now I don't really do random street photography anymore because if someone's wearing a mask, it's highly likely that they are having some sickness. If you see someone wearing a mask in the airport, I'm not going to talk to these people at all. So I only travel, when I'm invited to cover a mask required events, and all these people are super COVID conscious, and so testing are all required. Most of these people are, all up to date with vaccination as well. So I would meet these people and interview them for the documentary project. So I want to like continue to do this because this means a lot to me. It's also it's a great distraction for my chronic pain. When I get my mind off and just focus on working and serving the community, it helps me, feel better. Because sometimes like it's all, it's really difficult to get through, chronic illness when you have a focus that distract you. It works for me.
Julie, have you ever had any issues with the TSA or air flight attendants requiring you to take off a mask?
Yes. In 2020, starting when people are allowed to wear N95 or promoted, I started to wear actually elastomeric respirator, and I got into a lot of problems. Like I was harassed by, flight attendants, and I was, stopped by the TSA asking me to take my elastomeric mask off and put it through the scanner. And I think that one time I even documented, I post about it. It was so annoying and frustrating. I was wearing, because I really want to not make a spectacle, but really want to like create, a like awareness. I want people to see that you can decorate your elastomeric respirator like this. And I painted it, and I thought it would be a fantastic, pose to show. And they forced me to take off the mask. And so I said, I'm immune deficient. I cannot not wear a mask because, I don't know what is in your air right now. And they gave me this. So here, this is one layer, looks like a underwear made out of like cloth that you wear for
Oh
underwear.
my gosh.
One layer. I look at this guy, and it was kind of like almost, it has like, it doesn't look clean as well. Like he came over to me and said, here, you can put this on. And I said, no. But guess what? When you have no choice, you will still put that on. I put that on, and I held my breath the entire time. I basically almost feel like you're under the water diving, and you just cannot breathe. Don't inhale, get through this. And I told her, just hold my breath until I can get my elastomeric mask back. But I learned, right? So after that, I learned that I have to wear regular N95 or regular looking N95 mask. And it's risky, but when they ask you to take it off, hold your breath, don't say anything. No argument. If you start talking, then you have to breathe, right? If you just quickly take it off, done, and put it back on, it's just a split second. You don't have to breathe all the time. Train yourself, practice at home in front of the mirror. How fast can you do this? And they said, take off your mask. Okay, take off. Don't breathe. And then put it back on. Put it back on and quickly seal it too. Like make sure. Anyway, it's really funny. And so I get through this, and once I get over the other side, then I change into my elastomeric mask. But I still have like flight attendant coming to me and say, "Oh, your mask looks like you have a valve." Like they think that the large filter valve, and that's when you get into a really interesting conversation. So I have like even printed out like literature to show them, no, this mask does not have a valve, and I have to like show it to these annoying flight attendant who still somehow read their old guidelines on masking that people are not allowed to wear masks with a valve on the flight. And even though no one is wearing masks, I was the only one in the entire flight wearing a mask. They come on to me wearing a mask that looked like I have a valve and harass me. So traveling is a lot of drama in that sense. But I learned to be, calm and educated and prepared, so they cannot come at me. And I just smile and say, oh, here you can read this little print out and explain to you that this mask does not have a valve. And the flight attendant is like, oh, okay then. So these people will walk away and just leave me alone. And I usually take a Dramamine because I doze off very quickly with a Dramamine. And then I would just sleep the entire way. And then by the time they wake me up, it will be, oh, we landed. And time to go. So I don't eat it. I hibernate on the flight like a bear.
Right? Well, along that same line of thinking, what kinds of reactions do you get from security or even other passengers?
Huh?
What kind of reaction do you get from people? Like what reactions have you seen from people going along with this train of thought?
Well, lately has been much better. So I wear my float mask. As you can see, I put a sticker, a homemade sticker on it. It said long COVID, right? And so people are very sympathetic and they were like, oh, your mask look really pretty on you. And I got a lot of compliment from people now because I think they may be more educated about long COVID, are more aware. Like if these people come on to me and saw that I have a sticker that said long COVID, they do know that I'm struggling. So if they say more, if I'm in a healthcare setting, talking to someone that I need that person to wear a mask, I would definitely explain to them that, especially I like to talk about viral reservoir. I said, people can get frequent reactivation of the virus too. So I'm wearing a mask to protect everyone, not just me. And then, it's also to encourage them to, reduce their own risk, and they should wear a mask as well. When I'm asking them to wear a mask, it's not just about protecting me. They should be protecting themselves.
Yep. What about you, Keith? What kind of reactions have you had? You've been quiet over there, which is very un-Keith-like.
Julie has way more to offer in the terms of travel than I do, but I've gotten all kinds of reactions, and I've given all kinds of reciprocal reactions. So sometimes people are, just giving me the death stare, and I'll just ignore it. Other times I'm like, "What are you looking at?" Or I'll just be like, "I have measles," like very loud in a grocery store. And I'm like, "I got it. I got the measles," and I just walk away and get a can of corn or something. Yeah, I mean, it is what it is. Some people just look at you and they're like scared because they think you're sick, and I'm just like, it's preventative, right? But yeah, I mean, it ebbs and flows. I mean, first couple of years after all the different mandates and stuff were dropped, there was more sort of like acceptance, and then people were kind of having their why are you wearing that phase. But now people just don't bother with me. But also it's different for me because I'm 6 feet tall. I look goofy. People aren't gonna mess with me. Like, you shouldn't be wearing a mask, because I'm more likely to give them a piece of my mind. My wife sometimes gets different comments and just snarky things. My son has been pretty shielded from it. He just walks into crowds and is like, "Hey, what's up? I'm here. I'm wearing a mask. Whatever." And kids, for some reason, just don't even bother with him. Knock on wood. No matter where he goes, nobody ever questions it. He's just like, whatever. And the one time that somebody did ask, he was just like, "I just don't want to get sick. I never get sick, so I wear a mask," and that was it. They just went on about their day. So, yeah, it's touch and go.
Hey, Dan, what reactions have you gotten?
It kind of runs the gamut. We had an experience not too long ago where the kid and I walked into Target masked up, and then a small group of people walked in behind us. Like, I was on a mission to get something. We don't go to Target very often, and like, I was very focused on, we got to get this thing and we got to get on to the next task of the day. But I wish I had had more forethought of like this potentially being a thing that could happen. But like, someone in the group behind us was like, "Why are these people wearing masks?" I don't remember exactly what he said, but something to the lines of COVID doesn't exist. Yeah, something along the lines of the pandemic is over. Yeah, the kid's here next to me. Hi. And like, I kind of had a moment where I was like, I should say something here, but then like my brain short circuited on, I need to say something and I need to go get this thing that I came here for. And if I don't get the thing that I came here for, I will forget, and then I'll be upset because I forgot it. So I ended up not saying anything. But my wife also masks at work, and she, for the longest time, kept getting people asking her, like, when are you going to stop masking? Like, what is up with this? I noticed that you always wear this when you come into the office. And Corey's like, well, I live with two people who have long COVID, and like my spouse got knocked on their behind big time by COVID and subsequently has had relapse type things every time they get sick. So I can't really afford to unmask at work because I could potentially bring an illness home that would knock my entire household out of whack for literally months. Uh, People have mostly stopped asking her that now, but she says that she still gets looks from some people when she walks into the office, still masked up. Um, Mostly, I don't really even think about it anymore. Like, this is just a thing. This is just how I exist. Like, it's like bringing my cane with me when I'm going somewhere, or like, I don't know, wearing glasses. Like, it goes on the face when I go in to do something. It's been a while since anyone has commented on it, but at Costco a few months back, there was a lady who commented that she really liked my mask. She was one of the bakery employees, and I was able to have like a brief conversation with her and hand her a couple of the masks that I had, um, and give her some information about mask block and whatnot, and be like, "Hey, yes, you should be masking up. You are correct. The surgical mask that you're wearing is not great. I mean, it's better than nothing, but also like comparatively, it's like pavement and apples, basically, like completely different things."
Yeah, that last time we went camping at the grocery store, Dan's passing out masks to the guy at the deli counter.
Awesome.
That's great.
Yeah.
So, hey, Dan, I'm curious, do you have any measures in mind that you would like to see implemented across a broader scale to make travel more safe?
I would really love to see like good air cleaning on airplanes. Like, they're recirculating the air anyway, and I am not a technician or anything, so like maybe there's a valid reason that this doesn't happen, but I don't see a reason why HEPA level filtration can't be incorporated into that type of a recirculating air system. Like, I think that it would be spectacular to do that. I also feel like the airline staff should mask when they are on the flights. Um, like, I understand we can't mandate what people do away from work, but um, seeing as part of the reason why we no longer have any mask mandates to speak of was the airlines petitioning the CDC. Um, Not holding out much hope for that to happen, but it like really getting the people who work there day in and day out to mask up and to have better air quality on the planes would go a long way, I think. As far as like car travel and whatnot, my family's figured out how to do that. Like, we'd love to be able to travel to some place like South Carolina or Arkansas, but like there are other outstanding things aside from masking that are preventing that for my family. Um, the anti-trans bathroom laws being the biggest ones, but I don't know, just getting more people masking and a push for good air quality in public spaces.
Absolutely. Julie, do you have any thoughts on what measures you'd like to see implemented? I'm sure you do, to make travel more safe for everyone.
Okay, I will simplify it. I first, if they're gonna ask me to unmask, well, they better be wearing a mask then. So I would think that mandatory for TSA workers, especially the one that's gonna like do the security check, that person should be wearing a mask. And so that's number one. I think mandatory for TSA workers to wear a mask, especially at the security counter. And then the other thing is that person should also be routinely tested because it's high exposure for them as well. You know, they should be routinely tested, and then and they should have like good guidelines on sick leave. They need to test negative twice, 48 hours apart, before coming back to work, because they could be, you know, endangering, you know, TSA means like, you know, the long line of people queuing up every day to get through to the plane. These people are working in the highest exposure environment. We want these people to test routinely and be honest. And if they're sick, stay home and stay like until they're really clear before coming back to work. And so I think the guidance needs to be set properly for people who work in that kind of environment, and that's tied to traveling safety, right? And besides that, I think also they are exposed to other diseases as well, not just COVID. So they should be tested for other diseases too. And vaccination will help, you know, like if they can, like not everyone can get vaccinated, but if they are in that position, working in that counter, like vaccination is really important to protect them from getting really sick from all kinds of pathogens.
What about you, Keith? What would you like to see? And I'm very interested in what you have to say. You have to tell a joke, though. Okay.
I want to have a whole bunch of scary TV commercials that spook people into never traveling again. No, I'm just joking. No, I want to, you know, like Julie was saying, you know, if you have somebody who's working at airports, these are like choke points where thousands of people are coming in contact with this one person, right? So if that one person is infected, then you know that's a bad situation because those thousands of people are meeting with this one person. How many people are they infecting? Then they're going on, and then they're going into an environment that's, you know, high transmission because you're in a cramped space. So if they were all just leaving the building and then walking off into you know, a grassy field, sure, but they're all getting in these little tubes and flying for hours, and everyone's coughing and breathing the same air. So like it's pretty much the worst situation you can imagine. Besides, you know, church. If the priest has COVID and everybody's coming up to get blessed, you know, these choke points where you get one person who could impact hundreds, if not thousands, have to be, you know, masked, tested, air purifier right next to them, a bunch of them. So I totally agree with that. And also, you know, air purifiers need to be everywhere. They need to be something like a floor fan. So, you know, for decades, you go into a building, into a house, whatever, you're seeing fans everywhere, just blowing around the same dirty air, right? Well, that's fine, but we need to have, you know, HEPA filtration everywhere. And so if there's a hotel room, there should be a HEPA filter, even if they do say they have, you know, top-notch air filtration for the building. I'm not putting my health on that. And I'm not even saying, you know, with the air purifier in a hotel room, I'm going to feel completely, you know, safe enough to do it. But if they all have it, then you're reducing the amount of times your staff is getting sick. You're saving money on sick time for staff, on disability payments for staff, and so on and so forth, right? Because I think that's really the approach we're going to have to go at. You know, next is we're really going to have to focus on the wallet, on the overhead, right? Because people are just not buying into the whole, you know, protect yourself. You don't want to get sick, do you? Everyone's still going with this whole, it'll never happen to me. I'm healthy, I'm fit, I can't get long COVID, even though there's, tennis, like pro tennis players now coming out and saying, I'm done because of long COVID. Basketball players, I can't play basketball anymore. Um, people are just not buying into saving themselves, which is wild. And then we already failed at, hey, why don't you save your neighbor or the people down the street? So now we have to appeal to something that we've been hyper fixated on for decades, and that's money, right? So if you tell people you're going to lose a lot of money because when you get sick, or you don't have enough benefits, or your insurance isn't covering long COVID because they're still in that gray area where the insurance companies are going to try to weasel out of it, and you say you're going to lose thousands, you're going to lose this and that, people might be more more inclined to buy into it, right? But like I said, with like Julie was saying, we need the people who are in these choke points have to be protected because they're meeting thousands of people each day coming from all over the world. Our interconnectivity is really an Achilles heel for us, right? So the fact that you're hanging out with somebody who has the variant from, India yesterday, and they're having a coffee next to you in Boise, Idaho, like that's not a great thing when it comes to virology, when it comes to staying healthy, right? So our ability to travel is great, but it's also causing us a lot of issues, right? So what do? You protect the people who are, the most exposed and are going to expose the most people. And and we got to get those scary commercials that are terrifying to everybody, and be like, kids, you never want to travel. You stay home forever, kids. You don't go anywhere. You stay home with your grandpa, or you stay home with Muse because he doesn't go anywhere because he's worse than an old guy now. He's a homebody, and he used to be fun, and that's what you tell him. And you say, stay home and never leave. But no, you can still travel, have fun, and it's a little extra work, but you can still do it and you can still be safe.
Yeah, and there have been liability suits, so keep that in mind.
Yeah. There you go. All right. This has been a fantastic conversation. Thank you so much for everybody who was able to come and visit. Thank you for all of our guests for speaking. We do want to let you know that we are currently working on a request for proposals project. We accepted several high quality submissions, and we think some of them may actually help folks with traveling and with just supporting the Clean Air Aware community. So stay tuned for that. We will have more information on our website and our social media. A reminder that you can sign up for newsletters from PHAN at phan.global, phan.global/connect. We do weekly and monthly newsletters with information about upcoming events. We are having our next Zoom discussion on May 24th, and that is going to be about clean air in healthcare settings. And that is also going to be on, I believe, National Nurses Awareness Day. And we'll have a couple of nurses who, one or both of them are affected by long COVID, and they will have some great information about how to stay safe in healthcare settings and what we can do to make things better. So again, Melissa, you had a short blurb you wanted to do for Air Support Project?
Yeah. Air Support Project has a new project cooking. I know that we've been quiet on social media for a couple months, but we are trying to set up a new project called the Chicago Clean Air Resilience Network, which would basically greatly expand access to PPE as well as other clean air related hardware in the Chicago area. We're hoping to make an official announcement on our social media about it sometime this month. So stay tuned for that.
Fantastic. And yeah, Melissa, whenever you do that, we will share that out also and include it in our newsletter.
Yeah, PHAN is helping out with this project as well.
Yeah, we're big supporters of Air Support Project, so super looking forward to seeing how that turns out. All right, we will go ahead and wrap this up. We will get this recording up on YouTube hopefully today, and I will send an email out to everybody who registered and all the guests so that you have the link. And I'll also include the transcript of the chat because there was a lot of information flowing through there. So thank you all for coming. It's a great discussion. Really appreciate it. Julie, thank you so much for making time. We know that you're super busy and you've got your own long COVID issues, so we really appreciate your time and energy. Keith and Daniel, we really appreciate both of you coming as well.
Yeah, it's good to see you, Dan, and thank you for everything you do. Everything. You too, Keith. You're not too bad.
Yeah. Yeah.
Thank you for having me. And I just want to remind everyone that you can all do something about this too. Like post your mask portrait, show that you are, role modeling for other people to follow, and we can all make changes together.
Absolutely. You can follow Mask Together America on pretty much every social media platform, and Julie's just got so much great information that she's sharing, and beautiful, beautiful people wearing beautiful masks. I really like the decorated masks. I think that can go a long way towards, normalizing it and making people want to wear them. All right. Thank you, everybody. We'll call it a wrap.
Have a
Great
good
to
one.
see you. Hope folks can join us on the 24th for the clean air and healthcare settings discussion.
Yes, that'd be great.
Okay. Very good.
Bye,
See you
all.
all.
Thank you, everyone.